Hi, I'm Peter Rice, a professor of clinical pharmacy at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. I'd like to talk to you today about pertussis. Pertussis, or whooping cough, is an infection caused by the bacteria Bordetella pertussis. Pertussis causes a very unique and serious cough that can be life-threatening in very young children. The cough from pertussis is a very sustained cough, lasting a long period of time, tends to be it can be brought on by any outside factors. Patients aren't necessarily drawing a breath and coughing to get rid of any phlegm. The cough is caused by the microorganism. Children with Bordetella pertussis will cough for a long period of time, sometimes several minutes, without being able to breathe. At the end of that time, they can give a very characteristic whoop that gives whooping cough its name. For many parents, we worry about giving vaccines to our kids because there's always a benefit for the vaccine versus the risk of getting a disease. But if your child ever had pertussis, you would jump at the chance to give the vaccine. When my daughter was about 18 months old, our whole family caught pertussis at an event in Tennessee. And it went undiagnosed in my daughter, and eventually she coughed so much she lost consciousness in my arms. It's very, very, very serious and very, very frightening for parents. The question is, what is the riskiest age group for pertussis? Pertussis carries the most risk for very young infants. It's one of the vaccines that's given in the pediatric series right off, and parents should seriously consider giving the vaccine to their child at the youngest age possible. The vaccine for pertussis will cover the child during their childhood, but the vaccine tends to wear off. So it's recommended that folks have renewal of the vaccine whenever they have a tetanus vaccine. So the Tdap covers pertussis. It's even recommended that parents and grandparents be vaccinated with the Tdap so that they won't serve to spread the pertussis bacteria to very young children. Vaccinations are controlled by state laws, and most children have to have their vaccinations before they can proceed into a public school. So this is a vaccine that, if parents are refusing the vaccine, they'll be having their children have it when they're 4 or 5 years old. The benefit for this vaccine comes with younger children, so it's one that you're going to end up having your child vaccinated anyway. It's best to have the child vaccinated when they're very young. There really aren't any remedies for pertussis. If your child has a cough, there are different things that you can do that may help your child with cough. One of those is a humidifier or a vaporizer, and that will bring moisture into the air and tend to soothe the pulmonary tract and help keep your child from coughing. That will help loosen up any phlegm that your child might have. Cough syrup is not recommended for children. When it's actually studied, the cough syrup doesn't seem to benefit children with cough any. Honey can be used for coughs in older children. Honey is not recommended for younger children, less than a year young, because there are bacteria in the honey that might harm the child. And it has no activity against the pertussis bacterium, so if it is pertussis, it won't provide any relief for that. If you think your child may have pertussis, it will be a cough that has lasted more than a week or two. It will be a cough where they're not bringing up phlegm. There are laboratory tests that your physician can do to determine if it is pertussis, and there are antibiotics that can be given if your child does have pertussis. So it's important to check with your pediatrician if you think your child might have this.